Good morning, everyone. Thank you so much for being here. I promise I will not sing. Nobody wants to hear that this morning. Welcome. Thank you all for coming out on such a glorious Saturday morning. This speaks to the importance of this program, seeing all these wonderful faces in the audience. My name is Mara Bloom, and I am the Executive Director of the Mass General Cancer Center. I've been up here year over year, and it's wonderful to see so many familiar faces in the audience. I'm here today to introduce our 9th annual Survivors Day Conference. Our theme this year is Finding Your Place in a World After Cancer, Opportunities and Challenges. I hope that you will find today's program both interesting and inspiring. I am actually sure of that. I have a few jobs today. First, I'd like to talk a little bit about the program. We all know that the medical treatments associated with cancer are changing rapidly. How many of you have had targeted therapies, immunotherapies, CAR T cells, chemotherapy, radiation therapy? Who's had surgery? A lot of surgery. Those treatments are mind-boggling. At Mass General Cancer Center, our approach not only includes providing you the best medical care, but also providing you the best supportive care, supporting the psychosocial health of our patients and families, and your emotional health as well. It's so important. Every year, we talk about the stress and sometimes the PTSD and trauma associated with just being a cancer patient. How many of you have felt that as part of your journey? Many of you, and I hear that from many patients and also the family members. Every year this comes up as a theme, and this year we're going to tackle it head on. And I'm really excited about that we're going to have these great panels where we're not only going to hear from speakers who talk about the science, but how to support you in your emotional health journey as well, and spiritual health too. So I'm really excited about today's program. I also would like to thank Dr. Jeffrey Peppercorn, introduce Dr. Jeffrey Peppercorn, who is our Director of Survivorship for many years now, and he has spoken at this conference. But I'm introducing him in his new role. He's also been recently appointed as our Director of Supportive Care Services. And in that role, he oversees and organizes all of the supportive care services in the Cancer Center. But most importantly, he is our chief advocate for supportive care services and helps us not only support the services that you've had historically, but develops new services to support the cancer care journey. So thank you, Jeff, and then he will be up in a few minutes to give some introductory remarks. I would be remiss if I did not thank the Zuckers, who could not be here today. They have been our supporters of the Survivorship Conference since its inception. I'd like to thank the Zuckers and the Conquer Cancer Coalition for their tremendous support. We would not be here today at this conference without their support and backing of this program. Jonathan is also our artist in residence. He paints in the Yawkey and interacts with our patients. So if you'd like to see the art program, he's there on Wednesday afternoons. A few additional thank yous. I'd like to thank the Network for Patients and Families. Please raise your hands, network folks. They're probably all out front registering everybody. They helped design this program, they guided our agenda, and they're here volunteering and ensuring that today's program takes off terrifically. So thank you to the Network for Patients and Families. And then a final thank you to Steve Herskovitz for his leadership, wisdom, and guidance in developing and organizing this program, as well as the entire cancer education team, Devin Punch, Liz Brooks, Laura Hines, and others who've organized today's event. So now I'm going to ask Dr. Jeffrey Peppercorn to come to the podium.
Thank you. And I just also want to thank Steve and Mara. They've both been carrying on this fight for years longer than I've been at MGH. And I think they decided, okay, we need to put a doc up here, fine. But they've been doing this hard work, and they continue to do this hard work. And they're really key champions behind this. So I'm going to say just a few words about the new MGH Cancer Center initiative around supportive care. First, as someone who trained at MGH as a resident and a fellow, back at the turn of the millennium, as I thought about it back in 2000. I want to acknowledge that there's always been a dedication, ever since there's been cancer care here, there's been dedication to supportive care of our patients and survivorship care. Much of that work is delivered today and always has been delivered by our psychologists, social workers, and others who continue to do that, sometimes with thanks, but often without notice, just doing what's needed for our patients. And part of our job is to continue to support them. Our oncologists and our nurses have also consistently done their best to address the needs of our patients after that intensive initial phase of therapy, the surgery, the radiation, the chemotherapy, and as you heard, it's only getting more complex. And my clinical role models as I was training, people like Tom Spitzer, Ron Takvorian, Jerry Younger, some of whom you know, are still here delivering compassionate cancer care. However, while we have highly dedicated clinicians, and MGH has always relied on that and thrived on that, we have a large number of programs to help survivors. We clearly need to do more. And too often we hear that patients wish they'd learned about our programs sooner, or we identify needs that we're not clearly able to address right now. And I hear as a clinician, I'm a breast cancer doctor, as you heard, almost every week in clinic, patient will say something like, I'm struggling, I'm feeling adrift, I feel alone, after they've finished that initial phase of care. And even though I'm trying to run and organize this area, and I've been attuned to these issues even before I came to MGH, and they're mirroring the feelings that were captured in an Institute of Medicine manuscript called Lost in Transition that was put out in 2005. Some of you may know really sparked the field of survivorship care. So this is an ongoing and real issue. You'll hear about some of the ways we're trying to address it today. But I can promise you that we will be doing more next year and in 5 years, and we still will not be completely able to address this challenge. And we really need the input and support from those in this room to continue to help us get this right. So since October, as you heard, I've had the privilege to lead the Survivorship and Supportive Care Program. Our mission is relatively simple. One, we want to promote screening so that we can identify in various ways, and whether this is filling out an iPad or just having our doctors and nurses trained to ask the right questions, identifying the issues that are physical challenges our patients face, their emotional challenges, and even practical challenges, things like financial toxicity. Two, we want to help address our patients' needs, and that gets to building and supporting the programs we need to address all of the many challenges that people face. And three, we want to collect outcomes. That's for quality improvement, so we know how we're doing and we know which programs need more support or more investment, and also for research. And MGH, as you may know, has been a real national and international leader in this area. We're very lucky to have some of the best people in the world working in supportive care as part of our broad team. So I'm not going to go into detail today. You'll hear more from some of our speakers about all the work we're doing. But some examples, we're trying to, beyond trying to just strengthen our core supportive care programs in psycho-oncology and social work, we're working to develop a lifestyle medicine program that addresses fitness, diet, weight loss, exercise. We're working on building an adolescent young adult program, and some of the leaders in that effort are here today and will be speaking to you later, to address the unique needs of patients who are age 19 to 39. You can imagine all the things going on in life when you have cancer at those ages. We've developed and are continuing to expand our mind-body resiliency program that I think you will be hearing about later today. And we're supporting existing programs, things that have been here for much longer than I have, like PACT, Parenting at a Challenging Time, Integrative Therapy, and many other important programs. And we're also working on new and improved ways to try to get information into our patients' and our clinicians' hands to make sure everybody is aware of these programs. We're trying to streamline our referrals. So when I'm a frontline clinician, I can just pull up supportive care and get my patients into whatever programs I want to get them into. And importantly, we've built new networks and organizational structures to try to make sure that we get appropriate feedback from our patients and from all of our frontline clinicians in all these areas so that we can continue to refine what we're doing. So that's all I'll say. Sorry for speaking quickly, but there's a lot of work that we still have to do.